and welcome to a brand new episode of the Voices for Self-Care, where we advocate for moving national policies for self-care from mere policies into actionable and measurable implementation. Now, if you're new here, a very warm welcome. Please do make sure to subscribe and hit the bell button to get notified of new episodes. Today, we're going to have a very important and special guest with us who's going to help us dissect the topic from policy to practice, strengthening coordination and collaboration for self-care. We'll go on a short break right now, and when we come back, I'll let you know who it is. Welcome back. This is the Voices for Self-Care, where we advocate for moving national policies from policies to practice. Voices for Self-Care is the #1 show advocating for self-care in Nigeria. Now, before the break, I told you we're going to have a very special guest with us. And yes, we have him here. Our guest is a retired director and head of the Reproductive Health Division in the Family Health Department, Federal Ministry of Health and Social Welfare, Nigeria. Now, during his time in the ministry, he gained a lot of experience in family planning and reproductive health commodity security programming, and was involved in the task of repositioning and strengthening of the National Family Planning Program. Over these years, he played active roles in the continuous expansion of the family planning method mix through coordinated introduction and rollout of new products, including the DMPASC, SI, and HIUD in Nigeria. Now, this phenomenal man was a part of the ministry's team that managed the process of introduction of scale-up of self-care for sexual, reproductive, and maternal health in Nigeria. My esteemed viewers, please join me in welcoming Mr. Anyanwu Chinedu to the show. Welcome to the show, Mr. Anyanwu.
Thank you very much.
It's such a pleasure to have you on our show.
Yeah, I appreciate the opportunity to be part of this. Thank you once again.
Yes, sir. So I have been following up with Mr. Anyanwu for a really long time to get you on the Voices for Self-Care show, because your insights are so invaluable, and we're glad we finally have you on the show. Okay, yeah. Sir. So today I want us to talk about strengthening coordination and collaboration for self-care. It's a very important aspect for self-care. So my first question I have for you in that aspect is, since the development of the National Self-Care Guidelines in 2020, how would you describe the progress of self-care nationwide, especially during your tenure as the head of Reproductive Health Division? And while you are telling us that, I would like you to highlight the key milestones. What do you think were key milestones?
Thank you once again. I would say that since the self-care initiative was introduced in Nigeria, that we have made a lot of progress in the introduction and scale-up process. When we started, we brought together various stakeholders, cutting across government, civil society organization, development partners, so that views and inputs of these various stakeholders will be harvested and included in the national self-care program. And the government approved the use of the WHO introduced the global guideline to serve as the basis for development of our country-specific guidelines. So that was done, and with it we now came up with the National Self-Care Guideline on Sexual Reproductive Health and Rights in Nigeria. So with the conclusion or completion of the development of the guideline, the next task was, how do we disseminate it and how do we scale up the service provision itself? And we started, steps were taken to begin the dissemination process at the national and subnational levels, and we've made tremendous progress. It became important for states to buy into the process and own the program. And I'm happy to announce that Lagos state governments have been able to domesticate the National Self-Care Guideline and have Lagos State specific guideline on self-care for sexual reproductive health and rights in Nigeria. Also, I think Kaduna
yes.
and Borno states have made tremendous, have taken giant steps in the domestication process. So during the period also we're able to equally take the self-care initiative to the difficult, very difficult areas, difficult to reach areas, and the humanitarian setting, particularly in Borno State, where as a result of insurgency, a number of community members were displaced and could not access services normally from health facilities. Last but not the least, self-care products, including DMPAC, have been factored into the nation's quantification and procurement process, as well as distribution process. So this is very important, as it has helped us to reduce limited access. So across the country now, in all the states, you have self-care products and services being accessed by Nigerians wherever they live and work.
Okay, sir, so let's talk about the coordination of the Federal Ministry of Health, that's the FMOH. The FMOH has coordinated self-care interventions for about 4 years now. So during your time, how would you say the ministry had advanced self-care from just policies to practice? And then what would you say the challenges were? And for these challenges, what solutions were preferred?
Like I said earlier, the Reproductive Health Division under the Family Health Department continued to provide leadership and ensured coordination of self-care initiative in Nigeria. The body that is saddled with the responsibility to coordinate self-care program in Nigeria under the leadership of the Family Health Department, that's the National Self-Care Coordination Committee, was inaugurated, and they continue to meet regularly on a quarterly basis to assess progress being made in the process of scaling up the self-care program, and then identifying gaps with solutions provided. And mind you, the Self-Care Coordination Committee has in its fold a number of civil society organizations, development partners, government departments, ministries, and agencies. And coming to the challenges, I mentioned earlier that not about 25 states had been visited in the process of advocacy and engagement with policymakers. So major challenge is the inability to cover all the states of the Federation. Although self-care services are going on in the states, but that lack of interaction with the policymakers is limiting the process of their buy-in and also the process of domestication of the document. Another challenge is that out of the number of states that have been engaged with officially, it's only Lagos State that has completed the domestication process of the self-care guideline. I mentioned also that Kaduna, Borno, and a few other states are in the process of completing their own guideline. I don't know whether they have done it since I stepped aside, but that's something that needs to be continued with, engaging with the states to cover the number of states that are left behind, and then those that have taken steps to domesticate, support them to domesticate. Those that have not started, we support them to secure necessary resources to be able to now begin the domestication process. Another challenge is the funding for procurement of DMPAC, as well as other self-care products, which will lead to sustained provision of services. And when you look at this, you find out that the limited availability of self-care products across the subnational levels, particularly the health facilities, is a big challenge. A number of states are not doing last mile distribution as and when due, and the products that are outside the family planning program, which mandatorily are procured or provided by the federal government together with partners, those are the ones that are more regularly available. Although with the ongoing effort now for increased domestic funding for both family planning and other self-care products, we're hoping that there will be significant improvement. I think that if they are properly prioritized, then we'll be able to make further progress.
Amazing, sir. So some of these solutions you mentioned that the Federal Ministry of Health had already started implementing these solutions during your time as the head of Reproductive Health Division, especially the development of the NCC as the National Self-Care Coordination Committee.
Yes,
right, sir?
Yes.
Amazing. That's really interesting.
Inauguration and the regular meetings.
Okay, yes. And right now, Kaduna State recently just had a validation meeting for the domestication of the self-care guidelines. So this is
another
progress.
Plus for us.
Yes, that's another plus for self-care. So, sir, in your view, how does the collaboration between governments, donors, CSOs, and implementing partners strengthen the effective implementation of self-care in Nigeria?
It's very important in many ways. First, you are looking at human resource availability. Government cannot do it all. So when CSOs come in, they bring in the spread across the geographic area in Nigeria, the national and subnational levels. There are some CSOs, NGOs that are based at various communities. The human resource they bring in go a long way in supporting the dissemination and rollout process, as well as the engagement with individuals and families for to support them with necessary information so that they are in a good position to begin to practice self-care and not mistake it with self-medication. This is very important. Then you look at financial resources. The collaboration is helping to ensure that in the process of building capacity, in the process of distribution of commodities, self-care commodities, and in the process of enlightening the citizenry, the government is not able to provide all the resources. So resources coming from the federal and some state governments, as well as development partners, have gone a long way in ensuring that identified interventions or activities are implemented. So this is very important and should be encouraged, should be continued with. It's very important.
Mr. Anyanwu, let's talk about the sector-wide approach, the SWAP program. How would you say this SWAP approach contributes to, collaboration? And, for clarity to the viewers, you might want to just explain what the SWAP approach is about.
Okay, the SWAP approach is a key part of the federal government's health reform agenda, which aims at promoting equity, efficiency, quality, financing and sustainability of health service provision to ensure better population health outcomes. And it's also helping to properly identify priorities of government in terms of health intervention, looking at the policies that will help in driving those priorities, and also strengthening the institutions through which those reform agenda will be carried out. So the SWAP is helping the government in partnering with development, with stakeholders, including development partners, to ensure that holistic approach to implementing health interventions, especially by encouraging pooling of resources together into a common basket for funding, and then ensuring that different sectors are supported based on the level of importance accorded to each sector, and then they'll be funded and to ensure that appropriate health services are provided for the benefit of Nigerians. So the health sector approach in this sense requires that various stakeholders are brought together, and government has gone ahead to institute a RAMCA SWAP technical working group looking at sexual, reproductive, maternal, and maternal health, so that preventable maternal mortalities will be eliminated or reduced to the barest minimum. So this technical working group is meeting regularly, and it has in its fold a number of development partners, federal government institutions, and some state-level institutions. So this is very important because it improves coordination and coordinated implementation of identified interventions.
Thank you very much for that answer, Mr. Anyanwu. We're still talking about collaboration, and a key part of collaboration is active participation from key stakeholders, especially professional health groups. So how would you say, or how would you ensure that we get active participation from professional health groups?
I think I forgot to mention this as part of the accomplishments during my tenure as head of Reproductive Health Division. I remember we organized an orientation workshop for selected regulatory bodies and professional groups on self-care, and that was a major step taken to ensure that we expand the scope of stakeholders that are involved in self-care service provision in the country. And what we need to do is to continue with the engagement of this group. The outcome of that workshop, we need to refine it and ensure that the major agreements are implemented. And if we do that, that will set a big tone for engagement of more, for involvement of more of the professional groups, and then lead the way for private sector involvement, the core private sector involvement.
Thank you very much, Mr. Anyanwu. That's a very profound solution or advice, because engaging professional health group, like you rightly said, will go a long way in ensuring all that involvement, especially from the private sector. At this moment, we're going to go on another short break, and when we come back, we're still going to be discussing policy to practice, strengthening coordination and collaboration for self-care. Stay tuned. Welcome back. This is still the Voices for Self-Care, and we are winding down. We have Mr. Chinedu Anyanwu here with us. He's the former head and director of the Reproductive Health Division, Federal Ministry of Health, Nigeria. And we are talking policy to practice, strengthening coordination and collaboration for self-care. Now, Mr. Anyanwu, I'm going to ask you two more questions before we round up today. The first one is, what would you recommend, or what would be your recommendation towards advancing self-care for sexual and reproductive health in Nigeria? We've spoken about a myriad of things. We've spoken about collaboration with professional health groups. We've spoken about, the solutions to the challenges that you faced during your time. Now, overall, what would you say, what would you recommend, rather, to scaling up self-care for SRMH in Nigeria?
Yeah, I think it's important that we look at all the documents that have been developed for self-care, the National Self-Care Guideline, the DMPA-SC-SI expansion and sustainability strategy that has just evolved from the review of the DMPAC introduction and scale-up plan. So that plan was reviewed, and then the new one now is the DMPA-CSI expansion and sustainability plan. I'm mentioning it because of the important role, the critical role of DMPA self-injection. We need to roll that out alongside the DMPAC national guideline. Together, people will have tools that we can use to engage individuals, community members, and more especially the policy makers. If you recall, as a key outcome of the review of the DMPAC plan, which is contained in the new document, the DMPA-CSI expansion and sustainability plan, we've been able to review the service protocol for provision of DMPAC, and a major outcome of that review or second look at the protocol is the fact that now DMPA SCSI clients do not go home with one dose or two doses of the product, but three, which was a deliberate step taken to ensure that the number of clients visit to the health facility is reduced and the cost to accessing DMPAC is reduced. And DMPA-CSI is being used to encourage and stimulate community level self-care implementation. So that's why I said that document, the new document on DMPAC, needs to be disseminated alongside the self-care guideline and the self-care demand generation. So those three, it's important that all hands are on deck to ensure that we continue to disseminate them and then encourage the states to domesticate the documents.
Okay, sir. Thank you very much, Mr. Anyanwu. You're almost answering my next question, and I would have really loved to make you expand on the statement you made about encouraging young people to access self-care commodities discreetly, but maybe we'll have another conversation another time about that. Okay. And the last question I have for you today is, you spoke a bit about it, but I want you to expatiate on it. How would you say, or what efforts would you recommend for moving all these policies that we have already? What efforts would you say would help move these policies to actual practice?
Well, like you said, I've already touched on it. We need to engage stakeholders more, bring more stakeholders from ministries, departments, and agencies at the national and subnational levels, including regulatory bodies and professional groups. We also need to bring in the private sector so that we begin to do joint reviews. We begin to, that's joint review, maybe biannual and annual reviews to assess progress and see where gaps are. In doing this, we'll be able to know how much progress we're making and where we're still lagging behind. We also need to have an eye at what is going on at the global level and then harvest good practices that could be introduced into the national program. So, like I said earlier, we need to engage more strongly with policymakers at state level, because at the national level, the job of the workers there is just to coordinate and provide leadership, but the actual implementation is at the state level to let policy to practice. You need to really work with stakeholders at the subnational level, and some structures are supposed to be provided at the state level, at the community level. So those structures need to be put in place and the appropriate personnel put in place, and then with good funding and regular engagement of personnel within managing those structures at the national, subnational levels, then it will be easier to see, to ensure that these policy documents, these policy issues are practically in place.
Yes.
Then we need to engage individuals to ensure that health-seeking behavior is imbibed in them. So if everybody is cautious of their health needs and are able to take necessary steps to protect or continue to improve on their health, have good understanding of the available self-care products, and ensure that when visit to health facilities for professional attention is required, they do that. So I think that's when we will now say that we have finally been able to translate policy to practice. It's something that has to go through the whole spectrum of the healthcare delivery system, from national to subnational levels, even up to the family level and to individual level.
Right. Thank you very much, Mr. Anyanwu. This has been a very engaging and enlightening session. I really enjoy talking with you. I appreciate your presence here on the show. It has been really engaging and enlightening. And to our esteemed viewers, many thanks for tuning in. If you have any questions at all, please do make sure to write it down there at the comment section or send us a message at rancoms@gmail.com. That is WRANCOMMS@gmail.com. I remain your host. My name is Oyare, and I'll see you next time. Bye.